Welcome to the Senior Health video. This video will talk about 12 potential symptoms of amlodipine that doctors advise you to watch out for. Have you ever wondered why the very pill meant to protect your heart might quietly be putting it in danger? Across America, millions of adults over 50 begin their morning the same way, with a small white tablet they believe is keeping their blood pressure under control. That pill is called amlodipine, one of the most prescribed medications in the country. It is trusted, recommended, and taken by nearly 1 in every 3 people over 40. Yet behind that daily routine hides a truth few ever hear from their doctor. This medication, while effective for many, can also unleash side effects so serious that they change lives without warning. Most people never suspect the connection. They notice swollen ankles, strange fatigue, dizziness, or numbness in their fingers, and think it is just part of getting older. They never realize that their body might be signaling distress caused by the very drug meant to keep it safe. Each year, thousands of patients land in emergency rooms not because their heart failed, but because their medication quietly betrayed them. These symptoms can begin subtly, then progress silently until they become impossible to ignore. And what makes it even more alarming is that for every case officially reported, 10 more go unrecognized. Still, this is not a message of fear, but of awareness. Amlodipine remains a valuable medicine when used wisely and monitored carefully. The goal is not to abandon it, but to understand it. By learning the early warning signs and working closely with a healthcare provider, anyone can stay protected while avoiding unnecessary harm. Knowledge is not just power here, it is protection. The story that follows will uncover the 12 most serious side effects every amlodipine user should recognize before it is too late. Because sometimes the difference between a safe life and a silent danger begins with knowing what your body is trying to tell you. Number 1, peripheral edema. It often begins so subtly that most people never notice. Shoes feel tighter at night, and faint marks linger on the ankles after socks come off. For many taking amlodipine, this is not harmless swelling, but an early sign of peripheral edema. The medicine works by relaxing blood vessels to reduce pressure, yet this same process allows fluid to leak from the bloodstream into nearby tissues. As the day passes, gravity draws that fluid downward, filling the ankles and feet with trapped water that causes heaviness, discomfort, and tightness. Clinical studies confirm that the higher the dosage, the greater the risk. Only 2% of patients at low doses experience swelling, but more than 10% do at stronger doses. Women and older adults are especially vulnerable. Though usually painless, it warns that circulation is under stress and fluid balance is failing. Doctors often advise lowering sodium, elevating the legs, and reviewing medication to prevent further strain on the heart. One woman in Florida thought her puffy feet were from long walks until her doctor adjusted her dose. The swelling disappeared within days. But knowing this warning sign alone is not enough, because the next reaction can strike faster and cut far deeper than anyone expects. Number 2, angioedema. At first, it might seem like a mild allergy, a slight tingling in the lips, a small patch of swelling near the eyes, or a strange tightness in the throat. But for some people taking amlodipine, these early signals can quickly become life-threatening. Angioedema is a rare but severe allergic reaction that causes sudden swelling deep under the skin, most often around the face, lips, tongue, or airway. If the swelling reaches the throat, breathing can become impossible within minutes. Doctors explain that this happens when inflammatory chemicals such as histamine and leukotrienes surge through the body, making blood vessels leak fluid into surrounding tissue. Studies reveal that angioedema can appear even after years of taking the drug, safely leaving patients completely unprepared. Immediate medical care is critical because delaying treatment can lead to suffocation or cardiac arrest. Those who survive often require antihistamine steroids or emergency epinephrine to reverse the reaction. A retired nurse once described waking up with her tongue so swollen she could not speak. She reached the hospital just in time to breathe again. Her story reminds everyone that early recognition saves lives. But understanding this reaction is still not enough, because the next complication hides even deeper inside the body, where damage begins long before symptoms appear. Number 3, hepatotoxicity. The liver works silently every second, filtering toxins and processing everything we eat or take as medicine. But with amlodipine, that vital organ can sometimes turn from protector to patient. Hepatotoxicity means the liver becomes inflamed or damaged after exposure to the drug. It can start with fatigue, nausea, or mild abdominal discomfort that feels like indigestion. Soon the skin and eyes may take on a yellow tint, a warning that bilirubin levels are rising and liver cells are under attack. Research has documented cases where enzyme levels such as ALT and AST spiked more than 10 times above normal just weeks after beginning amlodipine. These are not just numbers, but signs that cells are breaking down. If untreated liver damage can progress to acute failure, demanding hospitalization or emergency care. The mechanism involves reactive metabolites that overwhelm the liver's ability to detoxify. One patient in Texas developed severe jaundice after only 10 days on the medication. When her doctor stopped it, recovery took nearly a month. That story shows how early awareness prevents tragedy. Yet knowing this is only part of the picture, because the next effect creeps quietly through the nerves, stealing comfort and control before anyone realizes what is happening. Number 4, peripheral neuropathy. It often begins as a soft tingling in the toes or fingertips, something most people ignore. But for those taking amlodipine, this subtle sensation can mark the start of peripheral neuropathy, a condition where the nerves outside the brain and spinal cord begin to deteriorate. The medicine may interfere with calcium channels in nerve cells, disrupting communication and slowly damaging the protective layers that keep signals steady. What starts as a mild burning feeling can progress to numbness, pain, or weakness in the legs and hands, making simple tasks like buttoning a shirt or walking on uneven ground difficult. Studies show that the risk increases with long-term use or higher doses. Seniors may find balance harder to maintain, raising the chance of falls or injuries. Doctors often recommend nerve-supportive nutrients, such as B vitamins, gentle exercise, and immediate medical evaluation if tingling or burning appears. Early attention can prevent lasting damage and restore comfort. A man from California once thought the pins and needles in his feet were from sitting too long. After stopping the drug under medical supervision, his symptoms faded slowly over several weeks. But understanding nerve pain is only the beginning, because the next reaction affects movement itself, twisting the body in ways few could imagine. Number 5, extrapyramidal symptoms. Imagine trying to keep your hands still, yet they tremble uncontrollably. That is how extrapyramidal symptoms can begin for someone taking amlodipine. Though rare, these reactions disrupt the brain's motor control system, leading to involuntary movements, stiffness, or muscle spasms. Patients may experience shaking hands, twisting neck muscles, or sudden jerks that appear without warning, often mistaken for aging or anxiety. This happens because amlodipine may subtly interfere with dopamine pathways, the same circuits that help coordinate smooth motion. Researchers have reported cases where long-term users develop symptoms similar to Parkinson's disease, including facial rigidity and slowed speech. These effects can be frightening and socially isolating, reducing confidence and independence. Doctors emphasize early detection, since adjusting or switching medication can reverse the symptoms before they become permanent. Supportive care like gentle stretching, balanced hydration, and rest may help relieve muscle strain. One man in Florida noticed his neck twisting whenever he tried to read. His doctor recognized the pattern and changed his treatment. Within weeks, his control returned. Yet mastering the body's motion is not the final challenge, because the next side effect strikes at the heart itself, the very organ amlodipine was meant to protect. Number 6, cardiovascular complications. Ironically, the medicine designed to support heart health can sometimes challenge it. Amlodipine, while effective at lowering blood pressure, may in certain individuals trigger cardiovascular complications, such as chest pain, irregular heartbeat, or dangerously low blood pressure. This happens when blood vessels expand unevenly, diverting blood away from already narrowed arteries, a phenomenon known as coronary steal syndrome. The result is a sudden drop in oxygen reaching heart tissue, leading to dizziness, fainting, or worsening angina. Studies show that older adults or those with existing heart disease face higher risks during the first few weeks of treatment or after dose increases. Rapid changes in circulation can cause fatigue, weakness, and even temporary loss of consciousness. Doctors advise patients to monitor for chest tightness or unusual shortness of breath, and to rise slowly from sitting positions to avoid sudden drops in pressure. A retired firefighter from Arizona once fainted while mowing his lawn just days after a dosage change. His doctor adjusted the medication, and his strength returned. But knowing how amlodipine affects the heart is still not enough because the next reaction steals one of life's simplest pleasures, the taste of food itself. Number 7, dysgeusia. For most people, food is comfort and connection. But some who take amlodipine find that familiar tastes begin to fade. This condition, known as dysgeusia, alters or erases the sense of flavor entirely. Meals that once tasted sweet, salty, or savory may suddenly seem metallic, bitter, or bland. The drug's interference with calcium channels in the taste buds disrupts how nerve cells send flavor signals to the brain. What seems like a small nuisance can quietly change appetite, nutrition, and emotional well-being. Researchers have found that taste disturbances can appear within weeks of starting the medication and may persist until it is stopped. Patients often lose interest in food, leading to weight loss, fatigue, and even social withdrawal during shared meals. Doctors recommend staying hydrated, chewing sugar-free gum to stimulate saliva, and using stainless steel utensils to reduce metallic sensations. A grandmother from Illinois once said she could no longer taste her favorite apple pie after years of therapy. When her physician adjusted her medication, flavor returned along with joy at her dinner table. Yet understanding taste loss is not the end, because the next change affects the smile itself, starting deep in the gums where few ever think to look. Number 8, gingival hyperplasia. At first it looks harmless, a small thickening along the gum line, or a slight swelling between the teeth. But for those taking amlodipine, this can signal gingival hyperplasia, a condition where gum tissue grows excessively and begins to cover parts of the teeth. It happens because amlodipine alters calcium balance in the cells that build gum tissue, stimulating extra collagen that the body cannot break down. Over time, brushing and flossing become painful, food gets trapped, and infection risk rises. Studies show that around 3% of long-term users develop this condition, most often within the first few months of therapy. Men are affected more often than women, and poor dental hygiene can make the growth worse. Regular cleanings and improved oral care can slow progression, while severe cases may need gum surgery once the medication is adjusted. A senior from Oregon shared how his gums grew so thick he could barely bite into an apple. After switching treatment and following strict dental care, his smile returned. But keeping the mouth healthy is only part of the journey, because the next reaction affects the mind itself, shaking emotions in ways no one expects. Number 9, mental health effects. Behind every heartbeat lies emotion, yet amlodipine can sometimes disturb that delicate rhythm. Some users report sudden waves of anxiety, unexplained sadness, or mood swings that appear out of nowhere. This group of reactions, known as mental health effects, may include panic attacks, insomnia, and deep fatigue that drains motivation and hope. Scientists believe this occurs when the medicine influences calcium flow in brain cells, altering how neurotransmitters like serotonin and dopamine communicate. Research has shown that older adults are particularly sensitive to these mood changes, often mistaking them for depression or stress. Patients may lose interest in hobbies, feel restless at night, or notice irritability that strains relationships. Doctors advise maintaining good sleep hygiene, practicing relaxation, breathing, and consulting a healthcare provider if emotional shifts appear. Support and awareness can restore balance before symptoms intensify. One widowed woman from Michigan described crying daily without understanding why, until her doctor traced the cause back to her medication. Within weeks of an adjustment, her calm returned. Yet peace of mind is only one part of health, because the next change reveals itself on the surface of the skin, where danger can appear in the form of a rash few see coming. Number 10, skin rash. The skin often tells the first story of what is happening inside. For some taking amlodipine, that story appears as an unexpected skin rash marked by redness, itching, or small raised bumps. While many cases are mild, certain reactions can turn severe, spreading quickly and signaling an immune response that should never be ignored. Doctors explain that the drug can trigger the body's defense system to overreact, releasing immune cells that attack healthy skin tissue instead of protecting it. Clinical reports show that most rashes fade after stopping or adjusting the dose, yet a few evolve into serious conditions like Stevens-Johnson syndrome, where layers of skin blister and peel away. Immediate medical attention is vital if rashes spread or are accompanied by fever or burning sensations. Keeping the skin clean, avoiding new lotions, and staying hydrated can help ease irritation during recovery. One man from Colorado ignored his mild itching until it worsened into painful blisters. Only quick hospitalization prevented lasting scars. His story reminds viewers that the body always gives clues, but recognizing the signs on the skin is still not enough because the next symptom reveals itself in sudden waves of heat rising straight to the face. Number 11, flushing. It can happen suddenly without warning. A warm rush spreads across the face, neck, or chest, and the skin turns a bright shade of red. For some taking amlodipine, this is known as flushing, a vascular reaction caused by the rapid widening of blood vessels near the surface of the skin. The same mechanism that lowers blood pressure also pushes more blood toward these outer layers, creating an intense feeling of warmth and visible redness. Though usually harmless, repeated episodes can be embarrassing, especially in public or during social moments. Medical experts explain that this reaction tends to appear during the first few weeks of treatment or after a dose increase. Episodes may last minutes or stretch for an hour, often followed by light sweating or dizziness. Deep breathing, staying in cooler environments, and avoiding alcohol or spicy foods can help lessen the effect. A man from North Carolina recalled feeling his face burn during a meeting and feared it was a heart attack. Once his doctor adjusted the dose, the episodes faded. But learning to manage this temporary reaction is only part of the story, because the final symptom reaches deep into the body, slowing one of its most basic rhythms of life. Number 12, constipation. Few people expect a blood pressure medicine to affect digestion, yet for many taking amlodipine, the first sign of trouble appears in the gut. Constipation is one of the most overlooked side effects, often dismissed until it becomes severe. By relaxing the smooth muscles in the intestinal wall, the drug slows movement through the digestive tract, causing stool to dry and harden. What begins as mild discomfort can grow into bloating, cramps, or painful straining that disrupts daily life. Studies reveal that patients using amlodipine alone are up to 4 times more likely to experience constipation than those on combination therapy. Older adults are particularly vulnerable because of slower metabolism and reduced hydration. Doctors recommend increasing fiber intake, drinking more water, walking daily, and never ignoring the urge to go. Small lifestyle adjustments can restore balance before complications like hemorrhoids or impaction develop. A retired teacher from New York shared how she struggled for days until her physician connected the dots and adjusted her treatment. Relief came quickly along with renewed energy. But knowing this final warning completes the circle, proving that awareness in partnership with a doctor can turn silent suffering into lasting safety. Every symptom discussed in this video tells a simple truth. Amlodipine can help when used wisely, but it can also harm when its warnings are ignored. Swelling, nerve pain, mood changes, or stomach discomfort are not random signs of aging. They are the body's way of asking for attention. Awareness is the first and most powerful step towards safety. No one should live in fear of their medicine, but everyone should learn to listen when their body whispers before it has to scream. If you or someone you love is taking amlodipine, never stop the medication on your own. Talk to your doctor, share what you have noticed, and ask questions. Most side effects can be managed safely with dosage adjustments, lifestyle changes, or alternative treatments. Small steps like staying active, keeping hydrated, eating balanced meals, and checking blood pressure regularly make a world of difference. Healing begins with understanding, and understanding begins with you. So take this moment to care for yourself. Save this video as your personal health guide and subscribe to this channel for more trusted tips on senior wellness, nutrition, and daily habits that protect the heart, brain, and kidneys. Each week brings new insights into foods and natural solutions that help you stay strong, independent, and full of life. The next episode will reveal simple morning habits that can balance blood pressure naturally and renew your energy from the inside out. Your health journey does not end here. It begins with awareness, action, and hope. Stay informed, stay safe, and never stop believing that change is still possible today.